State and local health officials say we are in the biggest COVID wave since the Omicron wave last winter. And while hospitalizations are nowhere near where they were in the previous wave, cases are up statewide. But with more people testing at home rather than at community sites, can health officials still get an accurate grasp on the number of cases in the community? I went to the experts to verify. To verify the answer to this question, I went to Mark Springer, the program manager for the Communicable Disease Program for the Spokane Regional Health District, and Lacey Fehrenbach, the Deputy Secretary for Prevention, Safety, and Health at the Washington State Department of Health. With more people testing at home, does that make it more difficult for, let's say, the county or the state to track COVID cases right now?
With the influx of at-home testing, both at the state and county level, there likely is an underreporting of COVID cases.
It does impact the numbers that we report on our website.
Both Mark and Lacey agree with more people testing at home, health officials are seeing fewer cases reported to them. In fact, Fehrenbach says the state estimates the number of cases reported to them represents just 15% of the active COVID cases in the state. And Springer says it's a similar figure in Spokane County.
Maybe 1 out of 6, 1 out of 7 cases that's reported, compared to what's out there in the community.
But both also agree that doesn't mean that health officials aren't getting an accurate gauge of COVID spread in the community. More than 2 years into the pandemic, epidemiologists have shifted how they track COVID spread beyond just testing.
The other thing that we look at, and this is a newer type of surveillance for COVID-19 that started in the fall and has expanded across Washington state, is wastewater surveillance. And that does help us see a trend in disease.
Both say while cases are up significantly in recent months and the number of people being hospitalized with COVID is once again increasing, there are some positive signs with this most recent wave.
The number of people and the rate of people who are dying is lower than almost any prior wave and even the whole pandemic.
So we can verify that yes, with the increase in at-home testing, fewer cases are being reported to health officials. But they stress they are still able to accurately track COVID spread. Both Springer and Fehrenbach say COVID's just not over, and they urge people to get vaccinated. They say while breakthrough cases do happen, if you're vaccinated, you are significantly less likely to become really sick from COVID.